Hey folks, it is Mrs. Johnson with the Agro Wisdom channel. I am going to do another story time this week. I apologize for not posting. Thanksgiving happened and crazy things in my life. Yeah, anyway, um, today we're talking about how I know about uterine prolapses, specifically in cattle, because I forgot that I knew what that was and how to treat it, and that I've seen it in real life. And now you get to know, and you get to see cute baby cow photos. So let's talk about it. Background. This photo is Dragonfly. She was my first like official cow, uh, when I still lived on a family homestead as a teenager. We got cows. Um, this is Dragonfly. This is one, or we got cattle. We got a couple steers, eventually acquired like like three or four like breeding cows and then a bull. And we raised those from weanlings. Dragonfly was no exception. She was about a year old in this photo. When she was pregnant, she was about 2 years old, which is early. Um, mm, Maybe too early. I don't remember. But she was our first cow to have a calf, specifically with me. Her calf was presented posterior, essentially back feet first. And now that I think about it, I don't remember if she was back feet first or upside down in the womb, but one of the two, which ties into uterine prolapse. So uterine prolapse is when the whole uterus is delivered or pushed out from the mother's body during birthing. And this happens in people, it happens in cattle, it happens in lots and lots of animals. And the most common causes are prolonged delivery, having a large baby, or a low blood calcium. Having difficulties during birth is also a common cause of this. And I should mention um, that Dragonfly, that cute little cow in that last photo, it was her first calf, and as I mentioned, was a uh, more difficult birth, particularly for her first calf, um, and turned in ways that made it hard for her to push out the baby by herself, especially when not knowing how to push a baby out, because she'd never done it before. So we had turned her out as per normal. Uh, because this was my first pregnancy, I didn't know a whole lot of the like really minute telltale signs that she was like gonna pop and have her baby. And my dad knew a lot more of that than I did and was like, oh yeah, she's definitely getting close. And I knew things uh like her milk ducts becoming active and stuff like that. So I was watching for those things and I was like, oh yeah, she's definitely close. And then turned her out to pasture, and we had went out working for the family business at a neighbor's house. We drove by, realized that she was like doing weird things out in the pasture. So we went out there, we checked on her. Turns out, and we were like, oh, that's a baby. And you look to be struggling. So then we helped pull the calf and all the things. Um, and she had struggled so hard that this black dotted thing came out. She pushed so hard and worked so hard to get that baby out that she pushed her whole uterus out. Um, and there's a so you have a side view of a cow, um, and then a like internal view of a cow. Um, Caudal. I'll mention this. Caudal is to the tail, cranial is to the head, axial, abaxial, left and right. You also have um, you have those two, and then you have head, tail, left, right, and then you also have one for like towards the sky and towards the bottom. So, those are descriptive words to specifically describe where what direction things are in correlation to other things, like north, south, east, west, but on objects. Let's talk about the treatment for literally pushing out your uterus. Specifically in cattle, but for pretty much any livestock. First and foremost, you want to call a vet or someone experienced in treating this. Some old school farmers, and ranchers and stuff, from what my dad has talked to me about, have the materials on hand. They have a vet and call. There's supposed to be a photo there. There's a photo out there. Anyway, and so they have all this stuff to handle it. We called a vet, and you're supposed to keep the animal as calm as possible because they literally have an internal organ hanging entirely out of their body. It's a different, they use a different term when it's only like part of the uterus, and it's not so severe. Um, Obviously because it's only part of the uterus. You want to move them as little as possible, and you want to enlist at least two people to be present at the time of treatment. So whether that's the vet and like the teenager that is helping raise cattle, aka me and the vet. Or like if my dad had the materials and knew how to do it, and me, because uteruses are heavy in cattle. And trust me, it's uncomfortable to have a whole organ pop out. Not fun. So then, step two is you want to wash the inverted uterus with warm water because you don't want to make the animal any more uncomfortable. And you want to use a mild disinfectant. My vet used iodine. The thing with iodine, and pretty much anything that you put on the uterus, is you want to wash the disinfectant off with clean water. You don't want to use soap, um, but warm water and a disinfectant. And you can like lightly uh, scrub the uterus, because you want to remove as much debris and the placenta as you can. You don't want to leave those things in, because they can cause things like infection and lead to like sterilization and death. And there's a weird name for like female reproductive infections that I'm forgetting. It's a weird, fancy scientific vet name. And essentially, that's an infection that can kill you in like 12 hours. Uh, yeah, anyway. The placenta in cattle is essentially Velcro to the uterus. That photo is a little graphic, so I don't want to like show it to you because this is YouTube. But Google it if you want. Um, because it's all like it's like the real life sponges, so it's like got little lips and things on the uterus, and then the placenta is velcroed by like strapping in on the other side. So like essentially how Velcro works. Um, and then once you have it all clean, super duper clean, and you've rinsed the iodine off or whatever disinfectant that you have, you want to use like sterilized water. That's important. So you want to make sure everything's sterilized and clean, um, when you like do this. Um, and then you want to push the 50-pound structure back into the body where it belongs. Experience doing this helps a lot. Uh, my vet did that for the most part. She did like have me help, and she did kind of explain what I was supposed to be feeling for and stuff. So then, because my dad had done it like decades ago, and he just like didn't have the know-how anymore to do it. And I wanted to learn. He wanted me to learn, just in case we had cows for like ever. We got rid of our cows, but that's a whole nother story. Uh, or he got rid of the cows after I moved out. Whole nother story. So once you push the structure back in, because I got derailed, you want to sew the vulva closed for at least a week, sometimes two, depending on the situation. And you want to administer antibiotics as recommended by your vet. I don't think we did antibiotics because my doctor didn't, or my vet didn't think we needed it, but I could be wrong on that. Um, and it is super important to get that cow treated because, or that animal treated because it does have a living, breathing, tiny, tiny baby that it relies on it to live. So, yeah, get that fixed. And then look. Megan and Dragonfly were perfectly healthy. Dragonfly had one more baby, well, with my dad. And as far as I know, she didn't have a prolapse. Um, the thing about a, an animal that is prolapsed once is that it is really easy for them to do it again because a lot of the connective tissues and organ placements that kept their uterus in place is now been moved and readjusted and not there. Not in a I'm gonna hold this thing in place. So you have to like once an animal has prolapsed, you want to keep an eye on them, even if they do have an easy birth, to make sure that they eject their placenta really well, without issues. It just makes it a lot easier for them to have issues in the future and prolapse again. Um, and yeah, um, Dragonfly, or no, yeah, no, Megan. So I called this little baby calf here Megan, because she was born in May, and I was a teenager, and I thought it was like a fun little play on words or play on spelling, and it was really sweet. So we officially got mom Dragonfly taken care of about, I say like 5, 6 o'clock in the afternoon. She had started giving birth probably about like 2 or something. And then I was tasked with making sure that little squirt uh, got uh, to nursing correctly. Um, and that was a fun adventure because we had milked mom, given some to little baby calf because it was going to be a while before mom was ready to learn how to nurse something. So we did that. Um, and I stayed up, I super late watching this baby. And and I don't know if you know this, but babies sleep for, especially when they're that little, they sleep for like 95% of the time of the day, uh, because they're just like little tiny babies. And so I would go out like every hour and a half, like between every hour and a half and three, while I was like sleeping. But I would at least get her up like once every 3 hours and like try and get her to nurse once every hour and a half, when I first started to get her to nurse. And then got to the point where, uh, and calves will headbutt uh, the udders to get the milk to flow better, like silly little guys. Um, and so by like hour 12, she was nursing just fine. And I actually woke her up from a nap. She had somehow figured it out between like one of the times that I got her up and tried to get her to do it, because you can lead a horse to water, but you can't make it drink. And I was trying everything I could to get this little baby to like nurse and like actually like me see it to be like, oh yeah, she is nursing. All I have to do now is make sure she nurses sometimes. So between one failed attempt and the next one, I'd gotten her up, woken her up from a nap, gotten her up, and been like, okay, hey, try this. Um, and she did just fine. She was like a happy little camper. She didn't need help at all. And I was like, bruh, why didn't you do this last time? And like, why are you so good at this now? Like, you seem like you got up in the middle of the night and like had it like figured it out, and you didn't need me pestering you for like the last 8 hours to get you to drink. But anyway, really cute. I really enjoyed it. I would definitely do cows again. 10 out of 10. Do recommend, especially the babies. Babies are so cute. Um, takeaways. And also another really cute photo of Megan when she was like itty bitty and learning how to eat grass like big cows, and definitely not the age to eat grass. It was very cute. Takeaways. Watch your pregnant cattle very closely, especially new mothers and mothers that have had previous complications. And then make sure your babies drink milk. And then enjoy the babies while they last. Yeah. Thank you so much for listening to my little spiel, and we will talk next time. Okay, hold on. Zoom is being weird. Okay, there we go. Have a lovely day. I will see you soon. Talk to you soon. And I hope you have a great, wonderful, amazing, awesome day. And I hope we learned some stuff. Okay, have a great day. Bye.